many people, both men and women, enter the nursing profession because they view it as a caring profession toward others. Since responding to patients' needs is a nurse's primary responsibility, compassion is frequently a quality that is expected of nurses.
How nurses care for patients is described in Jean Watson's Philosophy and Science of Caring. It discusses how nurses treat their patients and how this concern result in improved treatment strategies.
Watson-based criteria for nursing practice are the 10 following curative factors. Curative factors is derived from the term caritas, which means to cherish, appreciate, give special attention, and care with love.
I am Nurse John.
I am Nurse Cherry.
I am Nurse Lian.
I am Nurse Eliza. I am Nurse Julia.
First, including nursing practice, we will start our day by reflecting and centering ourselves to cultivate loving kindness. We promote self-care by running and exercising every morning before work. We go to work intending to use every opportunity to bring authentic caring to my relationship with staffs and patients.
Good morning, nurses. I hope you have a pleasant day and we have been assigned to Mr. Sagun, who's suffering from an unusual deformity infection and has been having difficulty coping with the change in body image.
Yes, recently Mr. Sagun has been having a problem coping that is stress response syndrome. He needs treatment that may help and we can assist him to overcome it.
Well, I empathize how Mr. Sagun must be feeling and consider how we might be able to assist and help with his physical, spiritual, and emotional needs. Nurses can check Mr. Sagun's condition and don't forget to apply the factors in nursing practices.
I will never forget that. Then we will go ahead. As you enter the room, I think of the two first curative factors, living kindness and being authentically present. I take a few seconds to be still and center myself in the caring moment.
Hello, Mr. Sagun. It's time again for your checkups. How are you feeling today?
I'm not feeling very well today. I look pale and everything.
I noticed that Mr. Sagun is wearing cover and is facing away from us. I have a feeling that he is suffering from this wound. Let me check your temperature and pulse rate, sir.
While Nurse 4 is checking the temperature and the pulse rate of the patient, Nurse 5 and 3 decided to ask the patient an open-ended question and attempted to probe about Mr. Sagun's feelings, which is listed forth in the curative factors so that they can work towards developing trust.
We have been told you are having a problem with your self-image. Can you tell me more about this?
I am different than I am before. I mean, look at me. How can I go out in public, hanging out or going to work looking like this?
The nurse noticed that Mr. Sagun looks awful and devastated. They must accept and not display their emotions at expressing. Yet, they will allow him to express their negative feelings. Curative number 5, acceptance and sensitivity to self and others.
This must be very difficult for you, Mr. Sagun. One can understand how hard it would be to go out and work, so what will you do with that?
Oh, that is so nice of you to ask. I am a teacher and just a year ago, I started making videos and needing to become a vlogger. Thus, you can see why it's so difficult for me to get out in front of the classroom and face the camera in my works. My students might laugh at me and my viewers will definitely make fun of me online.
Yes, I understand. That must be hard unless you are teaching a horror character in a movie.
Mr. Sagun and the nurses had caring moments. They spent the next several minutes talking about his job and other he does in the day.
Mr. Sagun, I have your antibiotic injection. This should help your infection so you will feel better and it can also affect your appetite.
What are you eating?
Lately, I have not been eating very well. The only foods that are good to me are fruits and vegetables.
Mr. Sagun, protein is very important to fight for your infection. I can see if we can have a nutritionist to come speak with you.
Thank you, I will get that.
I have used the scientific problem solving for decision making by providing skilled intervention to assist Mr. Sagun. In addition, I have provided teaching by informing Mr. Sagun about nutrition and providing services to improve diet.
Mr. Sagun and the nurses have developed a trusting relationship. They contemplate how they can help improve his environment.
The next day, Mr. Sagun is doing much better than in previous days. He's been admitted to the hospital, and the nurses went to his room to start a bright conversation with him.
Mr. Sagun, you look like a man. You must be feeling better.
Yes, I do feel good and better, and I'll be going home today. Thank you all so much for all of your help.
Mr. Sagun's recovery is amazing. I recognize that anything is possible